Hello, hi, this is Dr. Erica. Thank you for joining me on this particular video chat. I'm just going to go over some of the side effects of the progesterone class of medications. Progesterone, to give an overview, is a hormonal class that is normally produced in the body, but we see it in combination with estrogen, and we see it as a single medication for women who are going through perimenopausal and postmenopausal symptoms. And then we see it again with the oral contraceptives as well for family planning. So progesterone, again, is a hormone class, and normally we produce it, but we see it in medications more so. And after birthing and things like that, women become prescribed with this medication. Okay, so there are different generations: generation 1, 2, 3, and 4. Okay, the first generation is norethindrone. You'll see norethindrone with most oral contraceptive medications, and this particular first generation will cause effects such as spotting and sporadic bleeding at this particular first generation dose. Now, this particular dose is first generation, and it's an earlier generation, but it's more so seen in the oral contraceptives. Again, we see again the spotting and the bleeding. Also, we recommend progesterone as well as estrogen in those who have an intact uterus, those who have not had the hysterectomy surgery. Okay, so the second generation of progesterones are going to be those that cause less bleeding. They're a little bit stronger and long lasting. They have a longer half life in the body. They cause less sporadic bleeding and spotting. And with these particular class of progesterones, we're going to see more acne. We're going to see effects of not only acne, but facial hair growth and irritability. We're going to see changes in mood as well. So do be aware of that. Okay, and in the third generation of progesterone, we're going to see less bleeding, of course. We're going to see more thrombosis or blood clotting being found. And we'll see less of the acne. We'll see less of the a side effect of facial hair growth and spotting, but we'll see again more thrombosis and blood clotting being being there. So do be aware of that. Okay, and then the fourth generation of progesterones, we're going to see, we won't see any bleeding, usually no spotting. Everything will be on point, right on, and then we will see more of the blood clotting. We'll see less acne. We'll see less of the facial hair and irritability, but we will see again those side effects of um, blood clotting. So do be aware of that when dealing with the fourth generation medications. I'll go over the particular medications in each class. And again, you'll see these progesterones in oral contraceptives most often, and in women who have recently given birth. So you might not see them as single individual items, but again, you'll see them in the oral contraceptives. Okay, the fourth generation is going to be the drospirenone. Drospirenone, again, is a fourth generation class, and we're going to see more of the blood clotting. Okay, and then the third generation is going to be the norgestimate. Norgestimate is also a progesterone in oral contraceptives, and we'll see it in the third generation, and we'll see less of the side effects of hair growth, things like that, acne, but we'll see again thrombosis. And then an example of the second generation is going to be your levonorgestrel. Your levonorgestrel or norgestrel are going to be your second generations. Again, your first generation is progesterone syndrome. Okay, so do be aware of the effects of the progesterone class. Now, again, someone who you may see, you'll see progesterone again with oral contraceptives, and you'll see them with um, mainly with just the oral contraceptives, because those age ranges of people or females who are dealing with still dealing with their monthly female cycle will need a progesterone with the estrogen because of the endometrial effect. We don't want to have the endometrial effect of hormone replacement therapy. We don't want to see that. So we're going to add the progesterone along with the estrogen, because there is still the uterine bleeding, and the uterine is still there. So we want to be careful with that. Okay, so I hope you have any questions. Please let me know. I hope that has been very helpful in this particular video. See my other video on hormone replacement therapy, and please like, share, and subscribe to this channel. I'm Dr. Erica, pharmacist. Thank you for joining me, and I hope to see you on the next video. Take care. Have a good day. Bye-bye.